Good morning. What I speak from now on is not a figment of my imagination, but I will discuss these papers which have been published in peer reviewed journals, in fact, the top cardiology journals in the world. The New England Journal of Medicine, as I have mentioned many times earlier, is considered the best scientific journal in the world. And this had a paper on vaccine-induced myocarditis. There was a letter to the journal which was published in September last year. There were these two patients in their 40s. One was a woman, the other was a man. Both had either chest pain, palpitations, or breathlessness. The troponins were raised, which means there was damage to the heart muscle. Both developed this within days of their vaccination by a messenger RNA vaccine. And both had electrocardiographic changes, and also on the echo, sadly, both had a very, very low ejection fraction, which was about 15 to 20%. The woman survived. She was given methylprednisolone 1 gram per day, and after that, an ACE inhibitor and a beta blocker. The man sadly went into cardiogenic shock and succumbed. He died. So now we have a clear report published in the best cardiology journal in the world, in fact, probably the best scientific journal in the world, which tells us that following vaccination, one person has died. The report is of only two people. Both had a coronary angiography done, which showed that the arteries were normal. One of them had a biopsy done, that is the woman who survived, and which showed inflammation of the heart muscle. There was the presence of T cells, which are very important. Apart from that, there were basophils, eosinophils, and macrophages. But the important thing is that there were signs of cardiac inflammation, which means that the person had myocarditis following vaccination. In the case of the man who died, there was an autopsy done, and which again revealed that the coronary arteries were not only normal, there was no underlying heart disease, and there was definite myocarditis, that is inflammation of the heart. And importantly, in both these patients, there was no evidence of any other viral infection. So we have two patients who have developed myocarditis soon after vaccination. One of them has died. This was published last year in September in the New England Journal of Medicine. This year, I think sometime in March, that is 2022, JAMA has an official paper on myocarditis. The data is on 350 million vaccinations in about 250 million people, and they look for myocarditis. This is the official, almost the official CDC data. And here again, we have an estimate of more than 100 per million vaccinations. That is, myocarditis was seen at an incidence of 100 per million. And half of these were in people below the age of 30 years. The average time after the injection and the development of myocarditis was about 2 days. The mean age was 21 years. 80% were males. 98% of these people had a rise in their troponins. When you have a rise in a troponin, that means that there is damage of the cardiac cells, that is damage of the heart muscle. Apart from this, 70% had changes in their ECGs and 70% had changes in the MRI. And also, what is notable is the fact that 97% of these people required hospital admissions. So therefore, straight away, myocarditis following vaccination is not mild, because more than 95% were hospitalized. Of these, 87% recovered. What happened to the 13% is not provided in this paper. They do mention that 2 people have died, but they have little information on this. They also concede in this paper that this estimate is a passive surveillance system estimate, which means that this could be an underestimation of the incidence of myocarditis following vaccination. They also tell us that, which again is true, that they don't have long-term data on these vaccine-induced myocarditis. Now we come to the third paper, which is a German paper, which has been published just last month in a journal called Clinical Research in Cardiology. This has been authorized by German authorities. This is from the University of Heidelberg. This is a German paper. The remarkable thing about this paper is that this is an autopsy report. So now we have what we clinicians and scientists agree on, that the final diagnosis is based on the autopsy. So here, this paper is talking about 35 people who have died about 20 days following a vaccination. Of these 35 people, 10 were definitely not because of the vaccine. They were because of some previous chronic disease, maybe a drug overdose or an accident. But of the 25 people, and again, these are people who have died suddenly and within 20 days of their vaccination injection. This is an autopsy. That means they are dead, and we are looking at the histopathology, which is the final diagnosis. Here, of these 25, 5 were cases of myocarditis, which gives us almost a prevalence of 20%. Now, of these 5, 3 were women and 2 were men. The average age was about 58 years. Their ages ranged from 45 or 46 to 75 years. And all 5 of them died suddenly within 2.5 days of their vaccination. I think one person died within 12 hours of the vaccination. And therefore, because these people died suddenly within 2.5 days of their injections, there is no clinical data available, there is no ECG available, and obviously there is no MRI. But what is more important than clinical features or the ECG or the MRI is the fact that the hearts of these people who had died suddenly were examined by trained and very senior pathologists. And what they found was that these 5 people had definite myocarditis as defined by the Dallas criteria for myocarditis. Of these 5, 3 were very likely because of vaccine, and 2, the researchers say, could be possibly because of the vaccination. Because of these 2, one had some copies of the herpes virus, and the other person had the inflammation in the pericardial fat. But 3 had definite evidence of inflammation, that is myocarditis, in the heart. And also, the myocarditis was seen in the right ventricle and in the interventricular septum. The left ventricle was spared, so therefore one can theorize, one can postulate that possibly these injections, when they were given, somehow managed to enter the bloodstream and from there traveled by the venous system back into the right heart and inflamed the right heart. Now, as to exactly what is causing the inflammation is unclear. Either there is a direct attack by the spike proteins produced by these messenger RNA vaccines, or most probably there is an immune reaction, because the pathology, the histopathology examination revealed that there was a preponderance of T cells, and of these T cells, CD4 were dominating. That means there were more CD4 cells, which means that this is a sign that some sort of an immune response had been generated. So the important thing to remember here is that we have definite data now based on autopsies done by the Germans, published in a peer-reviewed journal, which tells us that as soon as 2 days after the vaccination, the persons have died, the histopath has been done. There is absolutely no evidence of coronary disease, that is, there were no blockages in the coronary arteries. There is no evidence of cardiomyopathy of any kind, whether it was hypertrophic, dilated, or restrictive. Also, there was no evidence of any other viral infection, including coronavirus itself. So there is no evidence of a viral infection. There is no evidence of a heart disease, of an underlying chronic heart disease. And also, there is a temporal association, which means there is a timing between 2 and 3 days after vaccination. And of these 5, I think 4 were after the first shot and 1 was after the second shot. And in all these 5 cases, the messenger RNA vaccine had been delivered. So in a nutshell, now we have information both on a clinical basis, we have surveillance data, we have data based on a biopsy and an autopsy done 1 year ago. We have this data, and this paper, the German paper, is much talked about because it is clearly telling us that 5 cases of these 25 people who died suddenly following soon after vaccination by the messenger RNA vaccine, we have definite evidence of myocarditis, and therefore one can presume, of course the researchers are a bit discreet or hesitant in using these very strong terms. These terms are being used by me. They do say that there is a very strong chance, there is a great likelihood that in 3 of these cases it was caused by the vaccines, and in 2 of these cases it is possible that this was caused by the vaccines. Now, of course, we also know that the regular myocarditis, which is produced by various viruses, can be lethal. The chances of sudden death or dying or the requirement for a cardiac transplantation is as much as 1 to 14% in young people. So this is a serious problem. And of course, all these researchers tell us now that the vaccine-induced myocarditis is not so dangerous, not so lethal. By and large, the majority recover. But the point is that we do have a sizable number of people who can have a serious problem and who are actually dying. We have a case report from Japan, from South Korea, from Australia, and also from Germany that autopsies have been done and in people who have died suddenly following vaccination, and they have found myocarditis. Now let's take the prevalence or the incidence which was provided to us in the article from the CDC. This was published in JAMA, which again is a leading cardiac journal, which tells us that the incidence could be as high as 100 per million. Now that means if we have an incidence or prevalence of 100 per million in India, where the population is 1,300 million at least, then we could be having about 100,000 to 130,000 people who are having myocarditis. And if 5% of these people have a sudden death or have need a heart transplant, then we are talking about more than 5,000 and 10,000 people, which is a very big number. But of course, in India, we have never used the messenger RNA vaccines. Our vaccination is consisting of the kill vaccine or the DNA vector vaccines. So in short, we have data which is not my creation. This is data which is published in peer-reviewed cardiology journals, which are the best cardiology journals in the world, which are telling us that there is clinical evidence, there is evidence as per the surveillance observation system that people are developing a myocarditis. These are usually young people. There could be middle-aged people also. In the young people, these are usually males, and in some cases this could be lethal because we have confirmation by now by an autopsy series study, which also again has been published by the Heidelberg University in a peer-reviewed cardiology journal. Thank you very much.